Welcome, everyone. We're glad you took the time to be here with us this morning. Emily Bean could not be here, so I'm Linda Riddle. I'm going to do my best imitation of Emily. Uh, and I think we'll get through it together. So today we're here to talk about resources for people living with HIV. And before we opened the meeting, the three of us were talking that even an experienced case manager may not have worked with a person living with HIV. And the resources we're talking about today are specifically for people living with HIV. So Linda will be talking about housing. Jillian will be talking about AIDS drug assistant. I can't remember what it stands for.
AIDS Drug Assistance Program.
AIDS drug assistance program. And I'll be talking about Maine Care and a special program that Maine Care has for people living with HIV. Let me get my PowerPoint going. And we're going to take questions along the way. So if you have questions, either unmute or put them in chat, and we will address them as we're going along. Okay, I am ready. Where is share? Here we go. Here we go. I mentioned I'm going to imitate Emily Bean today. So the goals for our work here today is for people to feel confident that they know where to find and how to connect a person living with HIV to important resources. So I'll be talking about connecting the individual to medical care, finding insurance and financial assistance options, and locating support services. So, finding medical care. There is a directory of Maine Care providers online. It's on the Maine Care website under, you can get to it a couple different ways, but it's a drop down from the member segment. I did this myself just the other day. If you are some physicians who have a specialty of infectious disease, which is the specialist that would treat a person living with HIV, they may be listed under internal medicine or infectious disease. So I have a list for you in this presentation of the physicians we're aware of that specialize in infectious disease. But certainly the provider directory is handy to see what physicians are in a reasonable area for your person to reach. All of the federally qualified health centers accept Maine Care. If the person is uninsured, here's a list of programs that are specifically for uninsured people. And then the Maine Medical Association has a directory of free clinics. So we're going to start about talking about the insurance. Oh, you'll get this PowerPoint afterward, but Southern Maine, I included New Hampshire and Southern Maine, has these clinics. We've got Central Maine and Mid-Coast has a few, and Northern Maine has a few infectious disease. Insurance options. Now, Maine Care has two different ways that a person living with HIV can get Maine Care coverage. One is that they qualify for Maine Care just as, you know, they meet the income guidelines to get Maine Care. The second is for a person living with HIV, there's a program called the Special Benefit Waiver, and that person can have income up to 250% of the federal poverty limit and qualify for Maine Care coverage through this special benefit waiver. It is virtually identical in coverage to Maine Care coverage. There's a few little wrinkles around hospice. The person may have Medicare, employer insurance, or they may be getting insurance from the marketplace. And then we have this listed as an insurance option. Jillian will talk about it later, but the Ryan White Part B program, the AIDS Drug Assistance Program, is helps to pay for drugs. So we listed it under insurance. Okay, so if the person is uninsured, here's how to apply. This explains under the blue boxes the two different pathways that they can get main care coverage based on their income, or if they go to the marketplace, they can get coverage that way. And we've listed the resources for contacting people. Now, if you're not sure which one to do first, ultimately it shouldn't matter because the two exchange applications, if they don't qualify for the marketplace coverage, that application will be sent to main care and vice versa. But here's the income limits. Under 138%, that's regular main care. 138 to 250, that's the special benefits waiver. Above 250, perhaps they qualify for the marketplace insurance coverage. Now, this just explains the special benefit waiver. It's, like I said, virtually identical coverage. So in terms of covering drugs, medical services, all of that, they do get access. All main care members living with HIV, whether they're under the waiver or not, get access to care management through a dedicated team at the Office of Main Care Services. And Emily is the manager of that team. And her contact information is in here. So if the person has employer health insurance, they can get help paying for their private health insurance from main care. So main care can help them pay the part that might come out of their paycheck to keep them enrolled in the employer plan. It's called FIP. I'm not sure how often you might come across this, but we thought we would mention it as another main care benefit. So we mentioned we're sort of cast the Ryan White program in the insurance options. This explains the two different segments of the program. If the person is earning under 350%, they can get drug assistance, health insurance premium assistance, some blood work, and financial help. Jillian will be talking about the dental, housing, and food, and all of those segments. If they're under 500% of FPL, but more than 350, they can still get prescription drug assistance, health insurance premiums, and some blood work. I can't emphasize enough how important the ADAP program is, because the person living with HIV, the most important thing for their care is that they stay on their prescription medicines. So almost, I'm going to say almost everyone, but I think it should be virtually everyone in Maine who's living with HIV should be able to access prescription medicines through Maine Care, through Ryan White, through an employer health insurance plan, or Medicare. So here are some resources that we use for education. We do have several webinars recordings up on the Main Care website that you can access, and the presentations that were done with them. You see what else we have. And here is Emily's contact information. So the program and Emily and our team really try to be a resource for everyone, whether they qualify for main care or not. So always feel free to reach out, even if you're not sure whether the person will qualify for main care or Medicare or whatever program. Emily is a walking encyclopedia. All right, how did I do on time?
You still have
Oh,
2 minutes you still have 2 minutes if you want to chit chat.
2 minutes. Okay. Um, any questions, any situations you've come across that um, we haven't addressed so far? Okay. So I am going to hand it over to Jillian, and I actually have to leave. So if there's questions for main care, please do reach out to Emily, and I will be helping her to answer those. So thank you very much for your time today. Oh, Jillian, over to you.
Yeah, so hi, I'm Jillian. I'm the HIV care program manager at Maine CDC, and that basically means that I'm in charge of the Ryan White ADAP program at the state of Maine. So let me share my slides with you. All right. So this is what I'm going to cover today. We're going to go over what our program is, both the Ryan White Part B side as well as the ADAP side, because they cover different things. And then I'm going to talk. I'm going to end with why the Ryan White Part B and ADAP program exists. What's the point? Why they're important. So ADAP is federally funded, and again, it covers HIV-related healthcare services and support services. It stands for AIDS Drug Assistance Program. It covers wraparound services for things that clients don't already have coverage of. ADAP's main goal, as she said previously, is really to make sure that clients have access to their medications. So we do everything we can to make sure that clients can fill their medications on a regular basis. We also fill gaps that other coverage sources don't cover. We're overseen by HRSA, which is the Health Resource and Service Administration, as well as the HIV/AIDS Bureau. And we are required to be the payer of last resort. So we come after main care, after Medicare, after all those other private insurance. We come after all of those other possible insurances before we come into play. So clients who are automatically enrolled in ADAP, they are applied for Ryan White Part B. Um, so they are different. For ADAP, you have to be 500% below the federal poverty line, which is like $78,000 uh, and a year. And for Ryan White Part B services, it's 350, and that ranges out to about 48 or 43, I think last time I checked. Um, And if you enroll in Part B, you automatically get enrolled in ADAP. If you enroll in just ADAP services, we do see if you qualify for Part B as well. We do need proof of diagnosis, but if you were diagnosed in the state of Maine, then we can get that from our systems. So we do have an application online. It requires a few things. There's the application itself, which is Form A. And it does require a signature on the consent form on this consent page, with this page 5. We do need a release for ADAP so that we can talk to your provider, your case manager, as well as your pharmacy if there's any issues with getting your medications. We need to be able to talk to those entities. So a signature is required on that page as well. We need proof that you live in Maine. If someone is unhoused, we will accept a letter from, it can be from our case manager saying that, like, I attest that John Smith is a resident of, the Portland area, and just sign your name, and we will take that as proof of residency. We do need proof of income. If the client does not have income, we do have a no income statement form, which is Form D. And like I said before, we do need proof of diagnosis, but if it's from Maine, we can get that ourselves. So some tips and tricks. The application process can get cumbersome. So if you have someone that's signing up for both main care, you should automatically try and sign them up for ADAP and pre-fill as much as possible, because it asks for a lot of the same things. If you know the client's name and address and some of their information, try and fill out as much as possible before they get there because it's already going to be a pretty long process. Make sure that you have the client bring all the necessary documentation that they need before they bring it with them to that appointment. Because you're not going to get very far if you don't have all the different things that they need proof of, because we need proof of a lot of things and main care needs proof of a lot of things as well. So you can get our forms at maine.gov/DHHS/MaineRWB. You can also Google Ryan White Part B Maine, and it'll get you to our page. All of our forms are there. We have them translated into French, Kinyarwandin, and Portuguese. If you find that you need a different translation, let us know, and we can probably get that for you. So now I'm going to go over the differences of what the ADAP program covers versus Ryan White. So as I said before, ADAP is 500% of the federal poverty level. We cover formulary medications, insurance premiums, and HIV-related labs. So we'll provide wraparound services for people that already have main care, Medicare, or private insurance. What that means is, like, if a client has a copay, or if their insurance only covers, a partial, if they have a high deductible and the insurance only covers, a partial payment on the medication, we will cover the copay cost so the client doesn't have to worry about that. If a client does not have insurance, it's our priority to try and get them enrolled in insurance as soon as possible. Because HIV medications are very expensive. They're roughly $4,000 a month. So we want to get people insured as soon as possible so that we don't have to pay $4,000 a month. So we can pay for premiums for people that get insurance through the marketplace. We can pay for employer plans. It does, depending on what kind of insurance you have, depends on the invoice we need. If you get your insurance through the marketplace, we need invoices. We do payments every 6 months. For employee plans, it's every month. If you don't recertify for ADAP, we can't pay your premiums. So if you don't certify for ADAP every year, then you will lose your insurance. We do have to have releases for the insurance as well. So whether it's Community Health Options, Harvard Pilgrim, Anthem, we do need to have a release for that specific insurance company as well. So that, again, we can talk to them about your invoices and payments and things like that. And we require that every year. So we do cover some labs. They have to be HIV related labs. These are some examples: the CD4, viral load, genotype, phenotype, profile assay, and then specific screening for a specific medication. We do have a 90-day limit. So if the bill is longer than 90 days, we cannot pay it. And we do have to have the bill itemized, meaning that we have to see what the insurance paid for towards each lab, to see what we actually pay for, because we only pay for HIV labs, so we have to see what we owe specifically towards those HIV labs. A lot of times people will get labs that they get a long list of labs when they go to their provider, and it's not just necessarily HIV labs that are being drawn, and we have to make sure that that's what we're paying for. So as I've said before, we do wraparound main care, Medicare, and other private insurance for formulary. We cover 100% of the formulary medications for uninsured. If you go to our website, you can look at our formulary. It's quite extensive. We cover most medications. And you can if you find a medication that you find is necessary that we don't cover, you can always make a case for that, and we could look at putting that into our formulary. So it's not something that's set in stone. We cannot reimburse a client directly, but for anything except for copay reimbursements, and that is only when the client is required to use a pharmacy that is out of network with our ADAP program. An example of this is like the VA. The VA is not in network with ADAP, so a client would have to pay their copay and then submit it for reimbursement to us, and then we would reimburse the client. Um, in all other circumstances, we do not reimburse the client. We need to pay the direct insurer or the direct pharmacy or whatever it happens to be. So if the client has any problems at the pharmacy, please have the pharmacy call our 800 number. It's just like a regular pharmacy help desk for any other insurance company. They'll walk them through, what the billing is for ADAP, why what the issues might be, and see what's going on. I encourage clients to bring their ADAP card with them when they go to the pharmacy. Again, it's just like a regular insurance card. So that's how pharmacies enter it into their systems as well. And now I'll go over Ryan White Part B. So, as I've said before, Ryan White is the payer of last resort. For Ryan White Part B, it is 350% of the federal poverty line and below. We can only pay for services that are 90 days and below. We can't pay for any past due charges. We can't pay any clients directly, and we can only pay when the funds are available. It's not as if every client is allotted at a certain amount. It's just if the funding is available, we can approve that application. We do not have any emergency assistance, and unless the client is a child, the client's name must be on the bill that we're being asked to pay for. So one thing that Ryan White covers is housing. Again, 350% of the federal poverty limit. It covers $750 per year. So that can be towards rent or utilities. You can re-enroll every April 1st. And it's a 2-page application. However, we do say that you should try and get a release from the landlord or the utility department, whatever it happens to be, just so that we can talk to them directly about billing in case they have any questions. And that way you as the case manager or the client doesn't have to deal. We can't pay for mortgages or security deposits. We cannot pay for hotels. And like I said before, it has to be directly to the landlord or the utility company. If they're roommates or a subsidy, we can only pay the client's portion. We cannot pay for late fees or financial charges, and we have to have a complete application and all the attachments before we can process the application. So we also offer monthly food cards. These are $50 food cards that can be used at Hannaford, Shaw's, or Market Basket. It's the client's choice as to what they prefer. It's a very simple 1-page application, and they can fill it out every month. If you turn it in early, we just hold on to it until the first of the month occurs, and then we process the application. So like I said, it's prepaid grocery store cards. You can't purchase any alcohol or tobacco using these gift cards. They're $50 each month. If the card is lost or stolen, we cannot do it. The Ryan White Part B program is not responsible for them, and we cannot replace them under any circumstances. And as I said before, if you turn in the application early, we just hold on to it until the first of the month comes around, and then we process it. So even if you turn it in early, we're not gonna. If you turn in an application November is soon, but you know what? If you turn it in November 2nd for December, we still have to wait for December 1st to come around. So we do offer dental assistance as well. That limit is $2,750 a year. Again, that starts on April 1st. It is a 1-page application. And we do need a dental plan to go with that application as well. Again, it has to be within 90 days. We can't pay for any past due charges. We can't pay for any cosmetic services, any orthodontia, or any temporary procedures like flippers. We can only pay in advance once for one visit at a time. However, we can pay for multiple visits after the fact, as long as it's in that 90-day window. So like I said, we need the treatment plan with every dental request. We only cover certain codes, so we have to make sure that the code that you're requesting is covered under our program. We have to have a complete application with the bill that shows an itemized procedure. And like I said, we can pay for one visit or several afterwards, but only one visit in advance. We do also pay for dental insurance if that's something the client is interested in. It would come out of that same $27.50 that is allotted towards their insurance. And then if they had any out-of-pocket expenses after the fact, they would need to submit an application for our dental assistance to help with any payments. So I wanted to go over why these services matter. Um, by offering these services, we basically break down barriers for clients so they can really focus on their medical needs. There have been several studies that show that people who are enrolled in Ryan White and ADAP are more likely to be virally suppressed, which is our ultimate goal, is to make sure that people who have HIV are virally suppressed and can therefore not transmit the disease to others. In Maine, viral load suppression among ADAP utilizing members was 90%, and that's compared to 84% virally suppressed who did not utilize any ADAP services. Nope. Oh. Oh. This is our contact information. I do recommend that you call our main line, just because sometimes people are out and you don't necessarily know who you're going to get. So call the main line. Also email. We have 5 staff members, so someone will get back to you. If you email one individual, then I can't guarantee we're going to get back to you. Again, call this 800 number if there's any pharmacy questions. You'll get much faster assistance than if you were to email or call us. You can go to our website for any applications, guidelines, or assistance. Our ADAP formulary is there. Yeah. Any questions? I did much worse on my time. I apologize. I talk a lot.
There is a question in the chat, Jillian.
Ooh, what's the chat? What's the chat say?
It's.
Let's see.
Will there be food
Yes.
assistance even with the snap cuts?
Very good question. So there will be food assistance even though the snap cuts are occurring. And we have made the decision that if you have any clients that did not submit an October application, you can still submit that in the month of November and we will approve it, just given the circumstances. So anyone, if you have any clients that did not submit any application for October, we will accept it, even in November. All right. Well, over to you're welcome. Oh, you're welcome. No problem. I'll give it over to you, Linda.
All right. All right. Did this work? Can you see this? Okay.
Yeah, we see it great.
Great, thank you. Okay. All right, HOPWA. So HOPWA is a HUD-funded program. Franny Peabody Center is the grantee. It's a HUD program specifically for folks who are living with HIV. These programs, there are 3 programs under the HOPWA umbrella. that are administered through this program. There's TBRA, STIRMU, and the PHP program, and I'll go over these individually. TBRA is a housing subsidy, so it's very similar to like Section 8. So it is a housing voucher that you would take with you to use in an apartment. That any landlord that will take it, the client will pay 30% of their income towards their rent, and the program will pay the rest of it. We do front a security deposit. So, but we do accept that. That does come back to the program at the end of the tenancy. And then if that person like loses the security, if the security deposit is lost to them or something, we may have to do another route because we can't pay out 2 security deposits. So it's one, and then it comes back to us, and then we send it back out again. So they have to be able to qualify for the program, they have to have an HIV diagnosis and also be 80% area median income or less. And that's a little bit different than the federal poverty level. It's their HUD's kind of like the average income in any given area. So in Portland, for a household of one person, the 80% AMI is $72,700. So that's an idea about where the basis is. If someone wanted to be added to the wait list, we do have a wait list. It's a couple years long, it's not as long as Section 8, thank goodness. But if someone be added to the wait list, they would want to fill out an application, or they want to have a case manager fill out an application and send it in. We're looking for an HIV diagnosis, so we need some sort of documentation of that, income information, any medical expenses, that sort of thing, and then we'll review the application and approve it, and then send that person a letter or whatever. So, so any questions about TBRA or the voucher program? Okay, the second part of this is STIRMU. So it's a short-term rental, mortgage and utility assistance. So so that's a good thing about it, kind of helps because ADAP can't pay a security deposit or mortgage assistance. We can pay mortgage assistance, utility assistance. We can pay for folks past rent and utilities up to $2,500 for a 3-year grant period. It's also 21 weeks of assistance. It's confusing. HUD makes these interesting stipulations here, but 21 weeks is basically like you take a utility and break it down, a monthly amount for a utility, break it down to weeks, and then you can have up to 21 weeks of assistance. So any more than per week, 21 weeks, we can't pay out. So then for 3 years, that's the amount that you're allowed. The person, again, must have an HIV diagnosis and 80% or less of AMI. We're also a payer of last resort, so you'd have to try things like GA, ADAP, any other kind of like assistance that will pay before they can do an application for us. The tenant can't use STIRMU if they have a housing subsidy, because that would be HUD would be paying to the client's portion and the other portion. So HUD won't pay twice. It's like double dipping. They need to show their expenses, make sure that they don't have more money or less expenses than works out for us to pay. It needs to be an emergency for folks to access this program. We'll need a clear narrative, releases of information for anybody involved, and W-9 to be able to pay out a check to folks. For shared housing, you can only pay for the tenant who is qualified for the program. So we'd have to pay half the rent or half the utilities for anyone who's living in shared housing. And I think that's it about STIRMU. Does anyone have any questions about STIRMU? And the last part is a PHP program. This is just for security deposits, first month's rent, or utility fees or deposits. So if someone has to get a utility in their name and they need to pay a deposit because they don't have maybe the credit or something, we can pay that upfront for them. A security deposit, same thing. It would be returned to the program at the end of the when it comes back. And that's kind of a one-time thing. But I mean, if we get the security deposit back, we'll always pay out another security deposit to a tenant. They have to be, again, 80% AMI and have an HIV diagnosis. And it's the same application as a STRMU. So if anyone wanted to fill out those applications, I'd be happy to send them out to anyone who needs them. Or if you want to meet, I'd be happy to go over those applications with anyone who might need to do them. And yeah, if you want to know if a client's eligible, if you want to know if they are anything about HOPWA, or if you want to talk about anything, this is my contact information. Feel free to call me anytime. I'm happy to talk about HOPWA with anyone. And that's all I've got. Does anybody have any questions or anything they want me to go over? All right. Seems easy enough. Hopefully I didn't go over that too quick. All right. So I guess, so Jillian, you don't have any other?
So,
anything?
we'll open it up. Any last, questions, mulling questions that you guys, main care, ADAP, housing, anything? All right. Well, I believe all of our slides are going to be shared with you. So if you attended, you should be receiving a copy of all of our slides. And our contact information is on those slides. So if you have any questions, please feel free to reach out. And hope everyone has a wonderful, hopefully it gets warmer, sunnier day. We can definitely, Sunshine, I can definitely put together a list of resources for you. If that's something that's easier, more attainable to you, that's not a problem.
Cool.
All right. Well, thank you, everyone. Enjoy your day.